Myself is Dr. Pradeep Kumar Goswami. I am a consultant gynecologist and obstetrician and a subspecialist in fetal and maternal medicine. I am the founder and director of Fitomat Foundation and the lead consultant in this team. Genetic counseling means counseling in relation to genetic assessment of the fetus as well as of the prospective parents. So genes or chromosomes are those part of the body of our body which is not seen through our eyes or through ultrasonography. It remains inside our cells. But it is that battery of our body which controls most of the body functions either directly or indirectly. Now, genetic counseling is necessary during the course of the pregnancy, sometimes when a problem is identified either through first trimester genetic screening or through second trimester assessment of fetal anatomy. Now, if a problem is perceived in the fetus, then a thought is given whether this can be a part of a genetic problem in the fetus. Because if it is an isolated problem, that can be potentially curable. But if it is a genetic problem, then it is usually multi-system involvement and potentially not curable, and therefore it is associated with potential long-term physical as well as mental handicap in the child. So, if a problem is identified in the fetus during the course of the pregnancy, most certainly a counseling session with specially trained genetic counselors are necessary. Again, genetic counseling may be needed if there is a history of a previous abnormal baby. Usually, this sort of counseling should be done in the pre-pregnancy stage. Therefore, if someone has a previous baby identified with a genetic problem, they should consult the fetal medicine clinic and a genetic counselor to see what was the possibility of a genetic problem in that previous fetus who may or may not have survived or surviving, and a plan needs to be made whether a prenatal diagnosis is possible as early as during the part of the next pregnancy, whether the baby is suffering from the same syndrome or not. Then sometimes the genetic counseling is necessary in infertile couple because some cases are related to genetic problems and what would be the cure of it or not. Sometimes there is a history of recurrent pregnancy loss, and therefore a details investigation is necessary to find out what would be the cause for the recurrent pregnancy loss or miscarriages, and some of the cases may be associated with a chromosomal and or genetic problem in the parents or the family, and therefore genetic counseling and appropriate planning may help in the issue of preventing a bad pregnancy outcome next time.